First impressions are priceless.
I'm Dr. Kenny Levine. For the past 37 years, we've been helping patients of all ages restore their smiles. Today, with modern technology and lasers, we're able to treat infants of 7 days old. We treat their parents. We help them not only keep their teeth, but restore function for the rest of their lives.
Call 954-603-7109.
Smiling is infectious, yes it's true. Please be careful or you'll catch it like the flu.
Hi, I'm Dr. Kenny Levine. Welcome to Health Talk. Health Talk is a medical show in South Florida that goes from the top of your head to the bottom of your feet. I happen to be a periodontist. I'm a dentist. I treat gum and bone disease, but this show is not about dentistry. This show is about all the medical issues that can affect you and your well-being for the rest of your life. You know, as a periodontist, I treat gum and bone infections. We treat them today with a laser. We do cosmetic procedures for our patients. Many times we are able to work with the restorative dentist. Always work with the restorative dentists who make the beautiful teeth. My job is to treat the gum and bone disease and to create the beautiful smiles with the dentist. And we treat patients of all ages. We treat patients from 3 or 4 days old up to their great-grandparents, people of almost 100 years of age. We do dental implants, restorations for these patients. You know, a lot of patients today are still anxious about going to the dentist. They're afraid that their dental experiences are going to be like that of their grandparents and their great-grandparents. But today's dentistry is not that type of dentistry. With the advances in cosmetic dentistry, the restorative dentists with bonding and veneers can do magic. Today with the lasers and with the procedures that we have available to create beautiful smiles, we can create beautiful and functional smiles that help keep your teeth for the rest of your lives. But tonight I want to introduce you to a very special friend of mine, Dr. Matt Soff. Matt, welcome.
Kenny, it's a pleasure to be here.
Well, you know, you are an internist and a gastroenterologist, and we've spoken before. Tell me a little bit about how you decided to become a gastroenterologist.
Well, if you're talking about medical treatment from the head to the toes, I basically take care of patients from head to toes. But my area of interest is gastroenterology, which takes care of a big hunk of the person in the middle. And I got interested in gastroenterology starting really in 10th grade. As a 10th grader...
What, you want to meet a girl or what?
Well, everything about 10th grade was wanting to meet a girl. But the most important part, the area of medicine that attracted me most when I was learning biology for the very first time in 10th grade was thinking about a 10th grade diet, which at the time was hamburgers, french fries, and milkshakes. And how does a person who eats hamburgers, french fries, and milkshakes frequently get that food absorbed, and how does that food become part of you the next day?
You know, you are an internist and you are a gastroenterologist. How do you divide your time?
I look at the patients globally. Many of my patients come to me, they're referred for a specific GI problem. And if they have their own primary care physician, then out of professional respect, we send them back to that referring physician. But there are patients that are sent to me by friends, relatives, and when they come to me, if they come to me for a specific GI problem or control of blood pressure, I look at them holistically. I look at the entire person. And if necessary, I'll treat their colitis, their liver problems, their heartburn, their blood pressure. So I'll concentrate on the GI part, which is the most fun and interesting for me, but I really am comfortable with treating the blood pressure, the cholesterol, the asthma, whatever the medical problem has. If a patient presents a problem to me, we're going to take care of the problem.
You know, I know you, and I know that you enjoy taking care of the whole patient.
Yeah, I've always been unable to just isolate and take care of this problem, because one of the more interesting things of medicine is the emotional part that comes with patients. Every one of us has an issue, a problem, a stress in our life, and it's fascinating to me to see how the emotional part of us affects the physical part of us. So I find if I'm treating blood pressure, but I know the patient is going through a divorce, if the person's mother is ill and causing particular stress, you can't treat the whole person without thinking about all the dynamics, the social, the economic. in this last few years, the economic problems that's going on in this country, putting a tremendous pressure on people, how they feel. The GI problems, the abdominal pain, the bowel problems, the heartburn, so many symptoms are worse during this financial problem.
We're going to get back to all those issues in just a moment. We're going to take a break now. I'm Dr. Kenneth Levine with Health Talk, and I'll be back in just a moment. Thank you.